Hi. So I'm going to give it a couple minutes just to let people join, but today I'm really excited to be talking about radiation and things to look for in regards to mastectomy tattooing. So I will introduce myself for those of you who may not know me. My name is Christina Siegel, and I am a medical tattoo artist, and I'm located in Columbus, Ohio. I have been tattooing the breast since 2008. I've been a registered nurse for 25 years. My background is has been primarily critical care. I worked neonatal ICU. I also worked in the burn unit, and I did bedside oncology nursing primarily with the head and neck ENT population and the gynecological population as well. And then I have over a decade of plastic surgery office nursing experience. At that time, if you were, maybe if you yourself are a breast reconstruction patient, you may have encountered somebody very much like me that provided care for you in the office setting. I did tissue expander fills, I pulled drains, I took out sutures, helped with office procedures just like nipple reconstructions, liposuction, all the way to facelifts. And it was that office setting for nursing in the academic arena that I did a very rudimentary form of nipple tattooing. So, and that was kind of the launching pad for me to become who I am today after training with really great body art tattooers. So that's kind of a little bit about me. I'm known as the Nipple Fairy. I own Living Story Tattoo, and again, I'm located in Columbus, Ohio. So today, I also made notes. I'm going to be looking down. I don't want to miss critical information to pass on to you guys. And also, this will be recorded. I'm going to have it in blog form as well on my page. That way it can be referred back to and shared for people. That way you can help others as well if they can't tune in today. So I want to talk about radiated skin specifically in the breast reconstruction population, and specifically how it can affect your mastectomy tattooing concerns. Feel free to ask me questions. If you have any questions during this live, if I don't know the answers, I will make sure that I find you those answers. I will ask people that have many different letters after the end of their name than what I have to ensure that you get the proper answer. And I'll also give a disclaimer, which I usually say anyway. I'm not a physician, nor do I want to state anything here that could replace critical information that you may get from your own physician. I am just speaking from my personal, hi Amy. I'm just speaking from my own personal experience, my experience as a registered nurse and my experience as a medical tattoo artist. These are just my opinions and my opinions alone here. So there may be people that disagree with me out there, and that's fine. So today, I really want to discuss things that are not just going to be beneficial to the client as I have in my past lives, but I want to give information that could also help tattooers as well, because many people that do tattoos for the breast cancer community are not medical professionals in a former life. So this information, I feel is really important. Before you would ever take on the responsibility of tattooing a survivor, I feel like you should make yourself acquainted with the effects of radiation. If you don't, I don't feel like that's prudent, proper care. So what is radiation used for in the medical world, right? So in low doses, we all know radiation is used for like x-rays and radiography and kind of for diagnostic purposes. But in the cancer realm at higher doses, it's used to shrink tumor masses and kill off cancer cells. And it can be given in a variety of different forms. So sometimes it's given as like a pill form. So radioactive iodine, for instance, will kill off your thyroid gland. There's brachytherapy that's done a couple different ways. One is by implantable seeds. So they take these little radioactive seeds and they put them in, for instance, the prostate to treat prostate cancer. The other brachytherapy would be like intraoperative therapy. And that's when the body cavity is open during surgery and they take a large amount of radiotherapy and they hit it directly onto an open site to kill the tumor, the cancer. And then you're closed up once your excision and everything is done. So that's another way. For me today, I'm going to specifically target you know, because the radiation is just one of the pieces of the puzzle, right, for cancer treatment. So, and these women that are going to walk into your office are extremely educated. They know their type of cancer that they had, if they were ER/PR positive, HER2 negative, whatever. They know their onco score. They know the treatments that they've had, and radiotherapy is just one of them. In addition to chemotherapy, and in addition to surgery that excised cancer and surgery that rebuilt their breast, it's just one of the many pieces of the puzzle that have been in this woman's journey that's sitting in front of you, and she's putting her trust in you to care for her and do only good for her and not harm to her. So it's just one of the pieces. One of the things, if a woman has had maybe a lumpectomy in the past, she may have had brachytherapy intraoperatively done to her breast. That is one situation that you should maybe be aware of as well. So external beam radiation treatments are primarily the type of radiation that you're going to see today in the breast reconstruction population. So external beam means it originates from a laser, from, or a machine, or however you want to think about it, in whatever layman's terms or however you want to describe it. It's in an object outside the body, and then that radiation is projected onto the skin diagnostically. So the skin is kind of a casualty in this whole treatment. It's trying to reach through the skin, through the structures of the tissue and everything, into where your cancer is located at inside the body, or where it was located at. So the skin is just something that's kind of, unfortunately, so to speak, in the way of the radiation treatment, because it's trying to treat something deep underneath the skin. So when we think about damage, that's something we need to keep in the back of our mind. This wasn't just locally isolated to the skin itself. So anytime you see those little blue-gray dots on the skin, like a lot of times you'll see them kind of midline centrally, sometimes here on the back. Those are radiation markers that have been tattooed by the radiation department in the hospital. And they're like a guideline that tell them where to project the radiation onto the body. So they're very important for the people diagnostically that are using the radiation. So when I neutralize one of those tumors, or I'm sorry, one of those radiation markers, the idea is you want to turn that little blue-gray dot into like a freckle, something that appears more naturally on the body so it doesn't draw the eye. And I only treat the midline of those radiation markers. I do not treat anything over here. Why? I personally, in my professional opinion, feel like I don't want to, because God forbid in the future, if there's ever a reoccurrence or another situation where that person would need to have radiation treatments, I don't want to hide where she previously had them. So I only treat the midline. And again, that's just my opinion. That's just me. There are people that would probably disagree, and that's okay. So having said that, when we talk about what ladies are going to discuss with you when they come in the door, sometimes you'll hear like that when they had radiation, maybe they hit their max. So there's a max radiation kind of cumulative effect that one human being can have in her whole lifetime. So maybe, let's say years ago, she had a lumpectomy with radiation, and then she had a recurrence or some situation arose. Maybe she found out she was BRCA positive or whatever, where she had to have a bilateral mastectomy or mastectomy, and she did not subsequently have any further radiation because she hit her max. So if you hear somebody say that to you, that's what they're referring to. Also, something to note, and just because it's something you don't really hear of a lot, but I've experienced it personally myself, and I'm just one person tattooing in Columbus, Ohio. For the last 6 years, I've seen 3 people walk through my door that in the 60s and 70s had full mantle radiation for Hodgkin's lymphoma. And then later, which was a common treatment. So in the 60s and 70s, they did lymph node to lymph node to lymph node to area, right? This whole mantle was hit with heavy radiation, and that was to kill the Hodgkin's. And then subsequently later in the 90s, these women developed breast cancer. So at that point, they had hit their full radiation max. They could not have any more, but I still needed to be aware, even though they didn't have radiation to their breast for breast cancer, they had radiation in this area. So I still need to be aware of that. It does happen, absolutely. So what is the takeaway of this for a survivor? it is very important for you to tell your artist about any radiation treatments that you had done, right? Show them, tell them that you had radiation, write it on your intake form, and show them where the radiation was done. Show them your radiation markers if you have them. Show them their skin. Allow them to inspect you, and just make it known in their head, because it's something that's critically important, right? Also, for a survivor, ask questions to your tattoo artist upon their inspection on your skin. Is your skin safe to be tattooed in their professional opinion? Just because your doctor said it was okay to get a tattoo, a nipple tattoo or a decorative tattoo or whatever, doesn't mean it necessarily really is okay. And I say this because it's happened to me. I've had a handful of women come to me for nipple tattooing, and upon examining their skin, I turned them down because it was, in my opinion, not a prudent, safe thing to go ahead and proceed with the tattooing, even though their doctor said it was okay. And even though their doctor gave them a note of clearance saying that it was okay. Now, again, these doctors are not from the central, like Columbus metro area that I typically tattoo from. They were from outside in outlier places in Ohio. I don't know them. I can't speak to them, but I do know I disagreed with them. And I didn't want to professionally be able to make the call on whether or not you feel like that skin is safe, because you're taking a big gamble, and she's going to be the one that takes the price or pays the price. You know, ask your tattooer, do you think my skin looks healthy enough to tattoo today? Also, ask your artist how much experience they have with radiated skin themselves personally. Like, how many clients have they done with radiation? If they've had any complications from tattooing with the radiated skin. Most people, I feel like, will be pretty forthright and forthcoming with that information. Ask your artist, what are the risks? Tell me about the risks that you know about tattooing me, and how will my tattooed skin on my radiated side maybe heal differently than skin on my non-radiated side. So you want to ask these questions to help ensure your safety, and ask them what techniques they're going to use differently on you versus somebody that has not had any radiation done. And ask them how many sessions you anticipate that you'll have. Hi, Carly. So as an artist, it is very important to ask a potential client if they've had any radiation at all, because they may they may forget to write that. If you don't have it asked on your intake form, they may forget to write it down, number one, if you're not asking them. Number two, I tattoo in medical facilities, right? Such as, I'm in a physician's office right now. This is where my office is located. I tattoo out of 2 cancer centers in the Columbus area. So when you're in a medical place, your mind tends to be in a medical mode, versus if they come to see you at a shop or like an esthetician office or something, their mind might not be in medical mode, so they may just forget. Also, radiation is a very traumatic thing for somebody to go through, and their mind protectively may just turn that off, and they might be pushing it to the back of their mind. So protectively, they may just not remember to really just be forthright with that information. So always ask as an artist. When you're dealing with a flap, also, it's important, like whether it's a latissimus dorsi flap from the back, or a deep flap or a tram from the belly, or gap, or a tug, or whatever. It's always important to ask if this flap was done before you had radiation or after radiation. It's ideally, if radiated skin has been damaged from the external beam, when the physician does a flap, they remove the radiated tissue and they move strong, healthy tissue with a good blood supply into that area to create a nice, healthy reconstruction. But there are some times after maybe a surgery where they've sent off your tumor to pathology, and it is determined, combined with your oncoscore and location and other things, that, gosh, you're going to need radiation after all. They didn't think you were going to need radiation going into the surgery just based on your needle biopsy. But when they send the tumor off to pathology, that can change. Also, sometimes cases, very difficult cases, will get presented at like tumor boards, where the meetings of the mind come, all these different physicians come together, and the tumor board will decide, gosh, yeah, we think it would be beneficial to save this woman's life, to give her more of a statistically optimal life-saving number. We're going to suggest radiation therapy. So then maybe she's had a deep flap already, and she ultimately has to go have that new flap radiated. So it's really important to ask if this tissue's been radiated or not once it's been moved up there. And I can show you some pictures too. Also, as an artist, be on the lookout for those radiated dots, those little markers, because like I said, sometimes people forget to tell you. And then once somebody will be right in front of me, there's nothing written down on her form. She disrobes, I look, boom, there's 2 little blue-gray marker dots right in front of me. And then I say, hey, did you have radiation? Oh my gosh, I totally forgot. I didn't even think about putting it on there. You know, it's just something that slips our mind. So always look and always ask, because a couple reasons. I'll show you pictures first of all. For instance, this gal she has an implant on one side. She initially tried implant with radiation reconstruction, and it did not work. It was too tight, too firm, too painful. So she came and had a deep flap. So everything from this line down, all of this skin used to be down on her tummy. Okay. So this flap is done after she had radiation. So here is these are my tattoo pictures, by the way. Here's her first visit where her tattoos are fresh and red. This is kind of a good example of like just different skin and how different skin can accept the ink. So here you can see on her implant side, she accepted the ink quite fully. On her deep flap side, even though it's not been radiated, it still turned out lighter because it's a separate skin donor site. Because different skin accepts different inks differently, right? So for instance, if you were doing 2 separate tattoos on 2 completely separate body parts made out of 2 completely separate types of skin. So that can be another kind of thing that is tricky and it complicates things. So this healed lighter. So at her touch up, what did I do? I hit this area with a little bit more concentrated color for another pass. And then I just did a wash over here to even everything out. This is a picture of, thank you, Ethan, I love you. This is a radiated implant-based breast reconstruction. And you can see here, this implant on her body has been much more tighter, it's higher, and the breast is smaller. And that's from the radiation effects. And you can see she had a little radiation dot here in the middle, and I neutralized it, that's why it's red. So when I talk about this skin being unpredictable, this is one of the things that's unpredictable. I tattooed her. She wanted a very light, natural, beautiful, just powdery result. And she got exactly that on both sides, despite the fact that this is radiated skin. And you can see this is a little bit darker. She's got some darkening here. So despite the fact that it's darker and it's higher and it's tighter and the skin is shiny, it took the ink exactly the same. So that's why I'm saying it's unpredictable. It can heal differently. This is a good example of a latissimus dorsi flap. So here she's got an implant. On this side, she had radiation. The physician removed the radiated skin that was damaged and would not cooperate with an implant alone based breast reconstruction. And they moved this little kind of football area shape came from her back. So that's an LD flap or a latissimus dorsi flap. And you can see I tattooed exactly the same. This is how she came after her first session, exactly the same. And here she looks okay on the flap that used to live on her back, but above the flap, see how light that is? That whole chest wall field has been previously radiated. So this skin all above this healthy skin paddle has been radiated. And you can see it didn't take the ink the same. It did not heal the same as it did on her flap. And it didn't heal the same as it did on the other side where she had no radiation. So on this side, for her touch-up, then I hit this area that's lightened with a more concentrated color, and I just did washes everywhere else just to kind of even things out. So this is unpredictable skin. And then to prove it's unpredictable, same scenario. We've got here, we've got implant-based breast reconstruction and an LD flap from the back, right? So this is her after touch-up. You can see this is 100% even take. She's even here on the implant side, she's even here on the LD, and she's even here on the radiated skin, chest wall skin. So this is 3 types of skin: an implant not radiated, LD flap from the back, and chest wall skin that's been radiated. And every single portion of the areola is 100% the same. Versus this lady, It's 100% not the same. So that's why this tissue, it's just so completely unpredictable. And that's why I like to do a two-step approach to the tattooing. So when we talk about two-step, the two-step approach, when I have people first come, I always explain all of these different scenarios to them, right? I very, very layman's terms. You can have an equal result on both sides. You can have a different result based on your skin type and the fact that radiation has changed your tissue. That's something that's very important. These women are super educated, as I stated before. So they are, you know, they're only going to want you to continue to educate them when they come and sit in your chair. They want to know that you understand their skin. They want to know that you're going to take good care of them. So always ask, always look. Because this skin, it's not with radiation, it's not like the skin gets treated and then it heals and then it gets better over time. That's not the case. With radiated skin, I have heard it doesn't go back, you know, to pre-radiation condition. And I have heard many physicians, especially Dr. Kochek, like he calls radiation the gift that keeps on giving. And when it keeps giving, what he's describing is it's giving in the sense that the skin has been forever changed. It's been damaged by this radiation. So it's not going to bounce back. There's documented, you know, side effects from the radiation, not just on the skin level, but internally, like heart, scarring on lung tissue. It goes deep into the body. The skin is just a casualty of this along the way. It's just, you know, collateral damage, we'll say. So, because it's trying to get into the body and it's trying to treat inside the body. So when we talk about when they're having radiation, many times women will get like skin burns, they'll get irritation. Locally, they treat it with Aquaphor and wound bandages and stuff like that during the afterwards. This is what you're going to see, and you kind of saw in the first picture I showed. You can have like darkened skin, hyperpigmentation, right? Telangiectasia, which is that kind of broken capillary blood vessel-y look where you see those reddish purple little kind of spider veins appearance on the skin. That's super common. The skin can be thinner, more fragile, tight, shiny. The breast reconstruction or the breast itself can sit firmer and higher up on the side of the chest compared to the side that was not radiated. So, and that's kind of what we saw in the first picture there that I showed. So another thing is capsular contracture of that implant is also very common. Many times, and that painful, the capsule will kind of become tightened and firm. And if that is not going to be something that she can tolerate or live with, many times that's why a woman will have a from the back come around, or from the belly moved up. That's one of the reasons they do the autologous tissue transfers. So when we talk about tattooing, the tattoo ink goes into the dermis as a liquid, right? It's a liquid suspension. The body absorbs the liquid component, and then the particles of the color get absorbed and trapped and held by the cells in the dermis, okay? So with radiation, those dermal cells have forever been changed. They have really been damaged, and their ability to trap and hold the pigment has been altered. And like I said, it's not something that gets better with time. So no matter when they have their radiation done, you still need to be aware that that could cause a problem. So like crisp lines, for instance, if it's a decorative tattoo, those crisp lines may not hold. Or like for a nipple, a 3D, if you're going to do that underlying, that little half moon kind of shadow to create the bottom of the nipple, it may look really crisp on your non-radiated side, but on your radiated side, it may be blurry. It may not hold those details exactly the way that you want those details to stick out. Also, just for the color in general, like I showed on the pictures, it can heal much lighter in comparison to the non-radiated side. So, and it's evident with like the one picture that I showed where the gal had, I love this picture to kind of be explanatory, because you can see that the ink above that healthy LD flap on that radiated chest wall skin is so light. But it doesn't always happen like that. Sometimes it heals the same, which is a bonus. So that's why I'm saying it's unpredictable and you cannot anticipate the end result. So that's why I like to do the two-step method. I don't ever anticipate, oh my gosh, this radiated skin is going to heal light, so I'm going to mix up like a more concentrated color or a more warmer color because I think this color is going to ash out or blah, blah, blah. No, I don't do anything. I think that's insanity. I am going to tattoo you. I'm going to mix up 1 cup of color, enough for both sides. I'm going to tattoo you with, techniques across the board, and I'm going to let your skin reveal how it will heal. So when you come back for your second appointment, it's going to tell me, your skin is going to tell me if it's going to accept it lighter, if it's going to accept it the same, if it's going to reject it completely. I will know everything I need to when you come back for your touch-up appointment, and I listen to your skin. That's the biggest thing. I also, more importantly, even than the aesthetic outcome, is the risk of doing damage to radiated skin. So I always start, as an artist, I always start on the radiated side, and I look for cues and I watch your skin to tell me how is it going to accept this ink and how much trauma is this skin going to be able to take before it tells me to stop. You have to listen to the skin as an artist. So it's fragile, it must be delicately tattooed. You really, really have to watch when it comes down to your heavy-handedness as well. That's something, big take home for artists wise. So, and remember, the skin's been permanently changed. So not only has it been changed by the radiation as far as like the way it appears, dark, firm, high, the skin is the skin is thin, it's shiny, it's got telangiectasia. Not just the appearance, but the appearance, that's kind of secondary, but its ability to withstand trauma and its ability to heal has been completely altered forever, for life. So that's big when we think about, safety. I always get asked by people, will nipple tattooing pop my implant? Can you pop my implant? Good Lord, hopefully God, no. If you are a reputable tattooer, you are only going to tattoo in the dermis, right? But this is a big fear of women who've had breast reconstruction, especially like pre-pectorally placed implants. There's skin and not a whole lot else before you hit that capsule and then implant. So there's not even pec there unless they're sub-pec. So this is a big concern for them. If you are tattooing safely, that should not be necessarily concerned. However, with radiated skin, creating a wound on a radiated breast mound can get infected or even not infected, and it can just erode. So when you talk about like tattooing as a dermal injury, you're in the mid kind of level of the dermis, right? We're causing a superficial injury to the top of your skin. And when you have a wound, wounds heal from the bottom up and then they heal from the sides in, and the skin comes to touch each other when we're talking about wounds. With a radiated breast, because its ability to heal has been impacted, this superficial injury from tattooing may erode. It may go deeper and continue to go deeper and wider and continue to get wider because its ability to heal is so and remember, like I said earlier, when they got the radiation was coming through the skin to treat something on the inside of the body. The skin is collateral damage. So it didn't just stop at the skin. The radiation has changed the skin and the underlying structures tissue-wise forever. So that's a big problem. So when you talk about eroding on a radiated skin, it can erode to the point that you do expose an implant. So maybe you didn't pop it when you were tattooing it like women are so scared of, but you can compromise a breast reconstruction, and that's very scary. This is a crucial element to understand when you're taking on the responsibility of tattooing a cancer survivor. I cannot stress that enough, like louder for the people in the back. You cannot be heavy-handed attempting to pack in a ton of color on these ladies. It will end in heartbreak. I've seen this firsthand myself from ignorant medical staff who take a very cavalier approach to tattooing in the medical physician office arena. When you have people especially who are not even medical, like maybe, like I tattooed as a registered nurse, but I know there are some places who have, excuse me, maybe medical assistants tattooing, front desk staff. I've heard of some people who have like their office staff, the lady that schedules your surgery, not even a medical person at all, do your tattooing. And that is it, and they don't know, and they're not trained. A, they're not trained tattooers, and B, they're not medical people. Excuse me, I had to take a drink. So when we talk about only doing good for people, that is one thing that I will definitely get up on my soapbox and I will talk all day long about it. I apologize. So in closing, I have personally tattooed 100 of radiated breasts in my lifetime. And I always examine the skin and make sure that it's safe to proceed. I always answer people's questions in lingo that they can understand because I want their safety to be paramount. And lastly, you know, put the concerns aside, right? Can radiated tissue on breast reconstructions be tattooed? Absolutely, most of the time, very safely. So with special precautions by an experienced tattoo artist. So with your physician and your tattoo artist together, when they come together, they can make that determination to make sure that you are safely taken care of. Because ultimately, that's the most important thing. You want to come out with a very beautiful tattoo. You want to get a beautiful result, but you also want to be safe. And damage can be done to radiated tissue. Do you guys have any questions? Okay, so like I said, I'm going to save this to my Instagram stories. I will also have this put on my nipplefairy.net page, and I'm also having it put in blog form. That way it can be referred to. And again, I hope I wasn't too, you know, like stand on my soapboxy and too, you know, too harsh sounding. But I do want to really drive home the fact that, you know, this skin has been forever changed and it needs to be really cared for delicately. So that's the main reason that I wanted to talk to you today. Oh, thank you. I love you, Amy. Thank you so much. So refer to this. You can share it with anybody you feel it may help. And like I said, I'll be saving it for you guys. So thank you so much. I'm so glad that you joined me. And if you have any questions afterwards, you can definitely DM me or message me in some way, and I'll make sure that I get that answered for you. So thank you guys so much. Take care.